All right, hey Mel, what's up? So I got an email from Head AT. I know you're on the volleyball team, but what position are you?
I'm a setter.
A setter? Okay,
Yeah.
and I know you've been having some problems with like knee hyperextension, so do you want to try taking it today?
Yeah, that'd be great.
Okay, perfect. So my name's Larissa Borkbala. I'm a student athletic therapist. Do I have permission to help you with
Yeah.
this? All right, perfect. So first thing I'm going to get you to do, I'm just going to get you to turn around.
Yep.
And I'm just going to look at the two hamstrings. So which one is it? Or
It's
which
my
knee?
right one.
Your right knee?
Yeah,
okay.
my right knee.
Yep, so I'm just going to look for any deformities, contusions, abrasions, burns, penetrations, or lacerations. I'm not seeing any of that. I'm also going to look for any, you're saying you're having not really tenderness, but that when
Yeah,
you get
it
in
just
that
hurts
painful
like when
range.
I go into that range.
Okay,
It's
yep.
just painful.
Yep, no worries. So I'm also going to look for swelling. I'm not seeing any swelling. I'm going to feel for heat with my hands if that's okay.
Yeah.
Okay. So they both feel the same, so that's good. Alter function, like we said, you're still playing. You just want a bit more support and prevent that kind of pain range.
Yeah.
Okay, and then no redness I don't see, and then you're saying like that pain in like that end range of hyperextension.
Exactly.
All right. Yeah, cool. No worries. All right, so I'm also just going to check our PMS while we're here before we tape. So looking at that pulse, that's good. Can you wiggle your toes for me? Motor's good, and you can feel that, right?
I can.
Perfect. Sensory is good. So the way we're going to start this tape job is that I'm going to get you to put the injured leg, or like the one we want to prevent, back.
Okay.
Excellent. And I'm going to want you to bend the knee a little bit. I want you to keep this loaded the whole time because I want that co-contraction, okay? So first thing I'm going to do, I'm going to spray it with the spray just to make sure the tape stays nice on. And then I'm going to do a couple anchors. So basically anchor at the mid thigh, mid hamstring here. I am using a 2-inch, so I'm going to go around twice just to give me a good anchor here. And same thing, I'm going to go around to that tib 2, find that tib 2 and go just below it. So here's her patella, down here tib 2. So I'm going to go about here because I want to avoid that peroneal nerve on the outside of the leg. Same thing, I'm going to do 2 anchors. Okay, so we're set up. Now we do want to protect the fossa right here, so we're going to put a heel and lace pad in there just to make sure that friction area doesn't get damaged. All right, so to figure out our range, I'm just going to ask Mel to kind of come into that hyperextension, tell me when it hurts.
Yeah, it hurts like
right there.
Right there, yeah.
Okay, so I'm going to get her to move forward about 10 degrees just to get her out of that range because that's where we're going to taper to prevent that. So in order to do this, I'm going to take my zinc. And we are going to measure our length. We're going to go about 1 inch above and below our anchors here. I'm going to rip that. So Mel, you can relax for a bit now. And so I'm going to make our little fan. So that's going to be my starting piece. Now you can make your fan out of 3 to 5 pieces. Give you a better view here. There we go. You can make it out of 3 to 5 pieces. Depends on your athlete. Mel is pretty small, so we're probably okay going with 3. So basically I'm making an X, having a central like X position. Same thing, making them the same length. Fanning that X. And then I'm also just going to put an additional one in the center just to kind of add that extra support in there. Okay, make sure it's all stuck together. Okay. So with this fan, I'm also going to want to just pinch the sides here, right where that X is, because that's where it's most vulnerable to tearing. So this is going to prevent that tearing. All right, Mel, you can come on back, turn around. We're going to get you in top position again. So once again, just go into that where that painful hyperextension is, right about there.
Yeah.
So I'm going to bring you forward again, and we're going to stick this on. Going about 1 inch above and below our anchors here. And then we're going to pull this down, just dog ear it, and we're going to re-anchor the top. Same thing. Now with this top anchored, this is where we can really work on kind of pulling that hyperextension or preventing it. So we can test it out and hold it here. So Mel, if you go into a hyperextension, how does that feel?
That feels good.
Feels good? Do you
Yeah.
want a little more resistance?
Maybe
or
just like a little bit. A little more.
Okay, so we can pull that while we're here. Actually get her to bend forward a little more, and that kind of brings her forward more into it. So how's that feel?
Yeah, that feels much better. Yeah.
Perfect. So we're going to heat mold that down. And same thing as the top, we're going to like dog ear that. And we are again going to anchor it. We can make sure that she's up on her toes during the bottom anchors so that we're in that contraction. Okay, perfect. So that's essentially the tape job. Since she's in volleyball, there's not really contact, so we don't have to be too worried about filling this all in. If she wants it for comfort, or if she's in a sport where we would have to fill in, such as rugby or anything like that where there's contact, we could. But would you like it filled in or no?
No, I think this is good for me today.
Okay, so and you said you're a setter?
I am.
All right, so just before that, we're gonna recheck our PMS. So our pulse, motor, can you wiggle your toes? Perfect. Can you feel that?
I can.
Okay, so good. So we're gonna do some sport-specific testing. So I want you to do like things like Sarah's, like shuffling, maybe a couple lunges, that kind of stuff.
Good.
Yep.
It feels good.
Okay, yeah, so you feel like you're kind of kept out of that pain
I
range?
do. I honestly do, yeah.
Okay, sounds good. There you go. You're good to go, Mel.
Thanks, Larissa.
No worries.